Dr. Alicia Angelo, and I'm the VP of Clinical Operations for the Primary Care Services at 360 Care. What I like about working at 360 Care is that there is a genuine excitement about working with older adults in the long-term care setting. 360 Care puts significant efforts into providing compassionate, holistic care to this population. The elderly are a joy to work with, and they frequently enjoy working with our nurse practitioners. Some older adults in the long-term care setting do not have family and friends that come to visit frequently, and so our nurse practitioners serve as a familiar face who they know that they can come to depend on. 360 Care offers a host of resources. First, beginning with provider relationships, who helps with onboarding and recruitment. The onboarding staff is adept at offering a seamless transition into a new role. Other services include the IT department, who helps not only with connectivity issues, but also with EHR templates and documentation concerns. The operations department also assists with scheduling appointments so that providers do not have to worry about scheduling follow-up visits with their residents. The credentialing department helps with making sure that our providers are adequately credentialed for all the services we offer. Lastly, our billing department also helps to ensure that our claims are processed in a timely, accurate manner. Our providers can be nurse practitioners and not have to worry about billing, scheduling, recruitment, and onboarding. They can focus on patient care and giving the best outcomes to their residents. 360 Care provides a whole host of services for the older adult population. In addition to primary care services, we offer audiology, dentistry, optometry, podiatry, behavioral health care. We also provide our nurse practitioners with a wealth of educational opportunities. We offer CME. Many of our providers have up-to-date for a clinical resource. We have regularly scheduled Teams meetings to keep our providers up to date with the best evidence. Some of the challenges that I have working in a nursing home is that we're caring for a very frail population that frequently has multiple comorbidities, and often there are unrealistic expectations about the outcomes for their health care. And this requires us to have compassionate, open, and honest conversations with residents and their families so that they can clearly understand their diagnoses, prognosis, and expectations for care. 360 Care certainly provides clinical autonomy. The leadership team offers educational resources that are based upon Medicare standards. However, from that point, the provider is able to use their knowledge, expertise, and the best evidence base to care for their residents as they see fit. 360 Care is not looking over my shoulder and micromanaging my treatment of my residents. They trust in the fact that I will follow evidence-based practice and Medicare guidelines to most efficiently, proactively, and compassionately care for my residents. As a nurse practitioner, my day begins by meeting with the Director of Nursing and Administrator and discussing any acute needs that may have happened overnight. I then begin to round on individual units, checking in on patients that I had planned to follow up on. 360 Care provides me with a schedule so that I know residents that I need to follow up with. I then identify any acute medically necessary needs by engaging in conversation with the nurses, therapists, and pharmacists. I'll talk with the nurses on each unit and identify any residents that have medically necessary needs. At the end of the day, I complete my documentation in 360 Care's electronic health record. That information is then uploaded into the facility's EHR so that they have that information in real time and it can be used to help with continuity of care. My advice to a provider considering working with 360 Care is that if you enjoy working with older adults, you enjoy autonomy and flexibility, this is a wonderful company to work for. They provide the resources and the support that you need, but allow providers to work in an independent, autonomous fashion. As a nurse practitioner in a long-term care setting, it is really important that the provider is able to engage with the facility. We have to build relationships with the nurses, with the therapists, with the pharmacists, so that they're comfortable coming to us with needs of the residents. Otherwise, those needs go unmet. And so the nurse practitioners must be willing to be vulnerable and approach nurses and see, how can I help you today? Do any of your residents have any needs that I can help with? It's also important that the nurse practitioner have good time management skills. They need to see their residents. They need to document in a timely manner so that information can be in the resident's chart if that information is needed by another clinician. Providers who are happiest working at 360 Care are those who are curious. Healthcare is ever changing. We know that we're constantly learning new ways to best treat our residents. And so providers who are willing to be open-minded and consider new evidence-based strategies to care for their residents tend to be happiest working at 360 Care.